This
our
conference will
newer.
now be recorded.
I would like Rick, as the founder of AnCan, could you give us a little thumbnail sketch about what that really means, and why you founded AnCan, and what that's all about?
My gosh, I should let I should let Alexa do that. She does it better than I. She does it much better than I do now. Um, well, I guess it's it comes from my own diagnosis for stage 3 cancer. Um, that made me realize the importance of support groups, and especially peer-led support groups, because peer-led support groups have so much more power um, than professionally led groups, and an awareness, because I was in a physical support group, that people who live a long way away, they can't join, either because there's too much geography, or socially they may not be comfortable going into a room, or they may have a physical disability, and
Sorry,
so
Lynn, real quick, do you have a microwave going off?
Oh,
I mean,
I do. I've got a timer going off. Supper's ready.
Okay.
um, and And so I looked, and there were only a couple of virtual support groups, one for postpartum depression and one for diet. And so I just had the idea, let's try and start virtual support groups. This was back in 2010 when I was in treatment, and we started off with the telephone and conference calls. Remember them? You actually, some people even had a rotary dial, but not too many. And it just grew from there. And then we became a 501c3. We started in prostate cancer, but it was never the intention to stay in that area. And today, in 2016, we became a 501c3, and 9 years later, we've got how many groups? 25 to 30 a month, right, Miss Alexa? Is that right? And we're about to start 3 new groups. One for our ladies, which matches the group that's going on right now in our other room, the men speaking freely. We were going to, I think we're calling it women speaking freely. I don't know, because
Yep.
Alexa's in charge there, but Alexa says women speak freely all the time. So I don't know if we get, but that's for all the ladies who want to talk about anything and everything except their treatment. So it's for all the other issues, the non-treatment issues, and that's going to be starting, I found out today, this month. So watch out, because everybody will get an invitation, and then we'll take it from there. We've got a caregiver care partners group for people with motor and neuro conditions. So that'll be for people with stroke or PD or MS, et cetera, et cetera. People who have cancer, who may be a hemiplegic from their cancer. So that will be getting that. And then we've got a condition which most of you have probably never heard of, but we've gotten to learn recently that it affects 1 to 3% of the global population, and it's called virtual snow syndrome.
Visual snow syndrome.
Visual snow syndrome.
Yes.
And visual snow syndrome is kind of like the older people here, if they remember when they turned on their TV, it was all fuzzy, and Sally remembers that. It was all fuzzy everywhere, and that's how they see the world, which isn't great. And so that's it. And we don't have any blood cancer specific sponsors, but we do have sponsors. We're not influenced by our sponsors. We don't do branded sponsorship. But I think for this group, FMI, does FMI sponsor? Yes, FMI is a sponsor for this group, right, Alexa? No. Okay. Well, they should be. Foundation Medicine, who does testing, but we have to try and get more. So that's it. I don't want to take up your time. I'm only here for a few minutes because I'm running over to the Men Speaking Freely group, which I enjoy as a participant. I don't moderate that. So I'll hand you back to Lynn. Lynn, thank you so much for stepping in to lead today. Really appreciate it. And the other Sally and Al who are on as moderators, thank you very much. Um, so that's it. Back to
Okay,
And yes,
Rick.
sorry, yes, Sally, I know I need a haircut, but I've tried twice. I failed twice because they haven't the lady hasn't been
It's
there.
been a
But
saga. He
you
has
know,
tried, I promise. He has tried. It's
he
just been
has.
a long story.
So did we lose Sally? Where's Sally gone?
Well,
I
Sally had company.
Yes.
Oh,
She was expecting company, and so she bailed out.
oh, okay, okay,
She forewarned us that they were coming, so I guess they must have arrived. So, well,
okay.
all right. Well, very good, Rick, and we appreciate you sharing with us. And Al has joined us as well. So good to have everybody on here with us. And
Right.
normally, if you know how to change your name, we normally put our diagnosis at the tail end of our name. You'll see on mine it says SLL, which is a type of non-Hodgkin's lymphoma. So if you can put the initials or whatever at the tail end of your name, normally you can point at your picture and at least do a right click. That's how I did it, I think. No, I think I clicked on the three buttons at the top. Well, yeah, edit name is what it says. Edit name and email. So that's how I did it for mine. So
And can
go
I
ahead,
just
Rick.
say one thing, Lynn? Since Sally isn't going to be here, we'll need to be sure to connect Derek to Sally. And
Okay.
but do we have other multiple myeloma people? Yes, we have Lou. Oh
Yes, we
well,
have Lou.
that's fine. So Lou's fine. So Lou's another coach. So we got Lou,
Okay.
and Lou will bring in Sally if needed. But yes, I just want to make sure we got support for Derek. So
Okay.
okay, I'll shut up.
Very, very, very good. Yeah. By coach, that means that they've have been around the block with MM and have had some training, and they'll try to answer any questions. They're not going to substitute for your doctor, but they'll be glad to answer questions and help you in any way they can. So, Audrey, we'll let you go first if you don't mind, and you can tell us when you were diagnosed and um, what your diagnosis was and what if you were in a watch and wait period before you started treatment, when you started treatment, so forth and so on. So you're up, Audrey.
Okay. Hi, I'm Audrey. I have acute lymphoblastic leukemia, ALL. I was diagnosed at the beginning of February, and it was definitely not a watch and wait. It was let's start this as soon as humanly possible. So I've been in treatment since early February, and I have just over 2 years to go. I'm in my course 2 of 5. Um, 4 of those courses are pretty intense that I'll be doing the next 5 months, and then I'll have 2 years of kind of a little less intense chemo. But so far, I was in the hospital for a month, not a whole month, but that was the plan for me to be in the hospital for the first month of treatment, and then I just do everything outpatient outside of that. So yeah, that's me.
So Audrey, what were the symptoms that you went to the doctor for, or to the hospital for?
So I had a headache. I was actually concerned about a brain tumor because my uncle had passed away from glioblastoma last fall, and so I just had kind of a dull ache in the back of my head. Um, and so I went to the doctor to maybe get like a neurological referral, but I'd also had a symptom of I like to run, and I hadn't been able to run more than like a quarter mile without getting really, really tired. And I thought that maybe I was just getting really bad at exercise. But turns out I had my hemoglobin when I went to the doctor was 5.4. So I just didn't have enough in my body to keep me going.
Do you know what treatment regime you were put on, or is that all just kind of a bunch of strange words?
I'm on the pediatric protocol. It's the CalGB 1043 or something like that.
Okay. And are you being treated by a community oncologist in your area, or do you go to a cancer hospital somewhere?
Yeah, I live in Charlotte, North Carolina, so they have a pretty big system here, so I just go. It's just about 15 minutes from my house, which is nice.
Sounds very, very convenient.
Yeah.
Anybody else have any questions for Audrey before we go on to Derek?
How old are you?
I'm 24.
Okay.
I was
Yeah,
thinking that you looked young like the rest of us.
I was gonna ask, 'cause I was I'll go back. I was gonna ask, are you connected to that adolescent and young adult community? Like, do you know about Stupid Cancer? Do you know about Teen Cancer America? Do you know about those particular, like, age appropriate resources?
I don't.
Okay. So I would like for you to send me an email, and I would like to get you connected to those communities and just send you some resources. And I think that that might be really helpful for you. I'm a two-time AYA cancer survivor myself, and I can tell you that doing that, getting joined in that community was very helpful for me. Not only was it really helpful, that's how I met my fiance, who's also an AYA cancer survivor. So I mean, it kind of paid off for me, but so, again, I'll put my email again in the chat, but just reach out to me. There's so many great things out there if you're an adolescent, young adult that aren't cancer specific, like diagnosis specific, but that they have, and even in North Carolina, people don't realize they have some of the best AYA cancer programs like in the entire country. They have like some of the gold standards. So, and all this stuff is for free, and I'd love to just be able to send it to you and help you out any way I can.
Okay.
And Audrey, do you have a port?
I do.
Okay. Okay. Yeah, I was
Um,
called just go ahead.
yeah, I was just going to say, and Alexa, what cancer did Kiernan have?
Lymphoma.
Um, Hodgkin's lymphoma.
Yeah.
So not ALL, but
No, 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 no.
I'm trying to send. I'm trying here. Here's Alexa's address. I keep sending it to Alexa and not to you. So there's Alexa's address. Please send us an email. We will connect with you big time. But we do have somebody who works with us and for us who is your age and is a Hodgkin's lymphoma survivor and was diagnosed a little bit younger than you, and she's doing absolutely fantastic. And so maybe we'll connect you there as well, because
Sounds
I
good.
think Kennan's fantastic, and I think it would be a great resource for you. We have talked, I just want to tell you, we have tried with the with Leukemia and Lymphoma Society we wanted to start a young person's blood cancer group, but they didn't want to work with us, and it's really frustrating because we don't have the access to the patients the way they do. They have a list, they could put something out, and you guys need a group. We know you need a group, and you need a group with people who you can relate to. Not that you can't relate to these old wheezers and geezers in here and the older. You can, but if you had a whole group of younger people, it would be fantastic. But sometimes working with these big organizations, they just don't want to know. They're not interested. They lose the plot. Anyway, we will connect you, and Alexa will connect you, because there's no one better in the country in terms of understanding and knowing AYA resources than Miss Alexa. She really does know. So, but hang in with us today, and we'll get you connected. And please keep coming back,
Will do.
okay?
Okay.
Because we care. All right.
Okay, and then Alexa, as we go along, if you have any questions, something we say you wonder about, um, please let us know. We'll try to answer your question. Certainly, I asked you about having a port because there are people on the call that have had a port or may even now have a port, so they can share that experience with you. So now we're going to go to Derek, um, and Derek, you're on deck.
Thank you,
We'll
Lynn.
give you some soft pitches here.
Right on. So let's see. Age 50, 16 years ago, I was having headaches, nausea, sinusitis, flu-like symptoms. And for about a year, they were chasing it, couldn't really nail it down, to find anything definitive until we did some blood tests. And the doctor came in and solemnly says, I hate to tell you this, but we found MGUS in your blood, monogamopathy of unknown significance, which is a excess protein, monoclonal protein that gets put in the blood or gets developed in the blood and starts displacing white blood cells over time. So at that point, that wasn't the issue actually that was causing all my symptoms at the time. It was a byproduct of looking for something. Of course, yeah, be careful when you go looking, right? And it turned out that I had valley fever in the end at that point. And so I was given the proper medication to eradicate the valley fever, and then hence survived that. The MGUS we've just been watching. I finally got to an oncologist, hematologist, and he's been monitoring me for the last 16 years with that MGUS stuff. I was originally diagnosed with, I believe, the IgA band and IgG bands that were in my blood. And at this point now, 16 years later, along the way, we've done bone marrow biopsies to monitor the percentages of the cells that's going on in there, white versus other. And knock wood, everything is holding pretty fast. It's been pretty slow, knock wood. And up to this point, he's still calling it a MGUS slash smoldering multiple myeloma, to the point of where treatment is not needed, or he feels that it's needed at this point. 3 years ago, along this journey, pardon the background noise, I live by an airport, I was having the same sort of symptoms again and thought for sure valley fever had returned. And it was not valley fever because they can test for that in the blood. And we finally did some CT scans, and they found some nodules on my pancreas at the time. And for about 6 months, we watched those nodules, and they started growing, or one of them started growing pretty rapidly. We did a biopsy of the nodule, and it came back benign, non-cancerous at that point, which I was very grateful for. Although my doctor, the GI gastro guy, at that point said, "Hey, I want you to still see a surgeon and discuss our findings with them." And I did, and I over a 3 month or 6 month period, I had lost 40 pounds in weight while this was going on during the period there. And I went and talked to the surgeon, and he says, Derek, you've got this nodule that's growing fast on your pancreas. You've lost all this weight. You're having these other symptoms. I would suggest you get it out as soon as possible. And so I hemmed and hawed and said, well, of course, that's what you're going to say. You're a surgeon. And but then I did decide to finally go with him. And I was on the operating table for 9.5 hours.
Wow.
He did the surgery fully robotically, so they did not have to split me open. We ended up doing a full Whipple procedure, which removed the head and neck of my pancreas where the growth was. along with part of my stomach and lower intestines. And then they glued it all back together. And here I am 2 years and 8 months later talking about it on my
Wow.
feet, up, walking around. And so I'm sitting in the hospital going through recovery, and my surgeon's at the computer, and he jumps back and goes, "Oh my goodness, I've got good news for you, Derek." And I says, "Really? Half off on the bill? What's the good news?" And he said, "Better." I said, "Better?" He goes, "Yes." He said, "You had stage 2 carcinoma on your pancreas, and I was able to get it all out surgically. And we left good margins and clean margins. And at this point, you're going to go on 6 months of chemo, which I did oral chemo as well as infusion chemo. And that was as a prophylactic type deal because that was after they found the cancer and resected the cancer. And then survived that. And again, here I am talking about it. But what concerning me now, of course, and I'm hoping that is all behind me with the pancreas side of it, is this MGUS smoldering multiple myeloma that's now coming into my future at this point. Knock wood, it's been slow, according to my oncologist, and he doesn't seem too concerned at the rate. But I want to learn more information about multiple myeloma, what ultimate treatments are available for multiple myeloma, and how do you know when you do need treatments, or what are symptoms of if there are any symptoms of multiple myeloma, what they are. Any questions for me?
I think Jim Marshall had his hand up. Go ahead,
Yeah,
Jim.
anyway, I got a question, Derek. Are you a veteran at all?
What is the question?
Are you a veteran?
I am
Are you in the
not.
military?
Oh,
No, I am
okay. Okay. I was curious.
Knock wood, I had very good insurance through my employment. I have since pulled the plug on employment, and because the survival rate, unfortunately, for those that have pancreatic cancer and what have gone through what I've gone through, is for 5 to 10 years survival rate 13%. So I looked at those numbers and said, "Hey, what do I want to be doing for the next 5 to 10 years of my life? Do I really want to be working or other?" And fortunately enough, I was able to choose other.
Another question. Where are you in the states wise?
Uh,
I'm curious.
of the stage wise,
No, no. Where are you
Geographically.
located?
physically located
Yeah.
in the Southern California area, Los
Ah,
Angeles area.
okay.
When I started going to MD Anderson for treatment for small lymphocytic lymphoma, one of the volunteers that we would see every time we went there was a survivor of pancreatic cancer, and he had been diagnosed in the 1990s, and it
Wow.
sounds like what his diagnosis was probably similar to what you had, and it was amazing to us that he was there. I mean, last time I saw him was probably roughly 20 years after he was initially diagnosed. So um,
There
he.
you go.
So
There is
anyway,
always hope. There's always
I
hope.
don't go to MD Anderson anymore. But anyway, that was an excellent and a surprise. My brother-in-law had pancreatic cancer, and we went. He was 54. We went to MD Anderson, and his was too far advanced. And I did read about the Whipple procedure that you talked about, spelled just like it sounds, WHIPPLE.
Like the
So
Mister.
yeah, that's great that you were able to be treated. So
Yes, it is. I'm
um,
a blessed man in that regard. Definitely.
yes, yes, yes,
Um,
amen.
right. What else was I going to say about that? Um, yeah. So yeah, like I said, multiple myeloma now is my next battle. Unfortunately.
Yeah,
Um,
yeah.
so Lou,
Well, I
talk
think
to me about multiple myeloma.
Yeah, I just jotted down a few things as you were talking. Just FYI, if you want to see a lot of short little videos done by doctors who discuss MGUS and the various treatments that are available, or watch and wait, whatever is out there for MGUS, you can go to the Health Tree website, and that's just the way it
Oh,
sounds.
I'm in a conversation
HALTHR.
with Al. He's asking me for meeting numbers. That's the only meeting number we have.
But if Sally were here, she would also, we're both coaches for Health Tree. So we've gone through training with Health Tree and learned about some various resources that are available. And the one thing that I learned a lot was to go through a variety of those videos that are available. And it's in the, what they call their university part, you know, that's got the videos. And what they do is they go to conferences that doctors attend to present their research, such as ASH, which is the hematological meeting that they have every December. And it's where the research teams go to present whatever they've been researching. There are others, ASCO, I think, is another one, and there are several, but those two come to mind. But Health Tree, what they'll do is they will catch the doctors in between the sessions, and they will ask them about their research. And then they'll do, it's usually 3 to 5 minutes of sharing about their research, what's the latest recommendations for treating things such as MGUS and myeloma, full-blown myeloma. And so I find that very, very helpful, especially for patients who are fairly new, you know, to this journey. So that's one recommendation. The other thing is you can sign up for a coach, and there are some in the list of coaches that are available, which I think exceed 80 coaches now on the website for Health Tree. And they have some coaches who are specifically trained and have gone through or are MGUS themselves. So that's helpful too, to have a coach who is actually considered to be at that level of MGUS. So that's just something that came to mind that I thought would be helpful. Also, if you're seeing, and Sally would say this too, because I've heard her say it a million times, if you are seeing a hematologist oncologist, that's great, but overseeing your care, make sure it's a specialist, a myeloma specialist. There are 2 or 3 studies that are available, and you can find those on Health Tree website as well, that talk about if you are seen, if a patient is seen by a myeloma specialist, that means like the majority of their patients are myeloma patients. The survival rates increase by 5 years. So that's pretty significant, and I think it's worth checking out. And it does not mean that you have to change your oncologist, hematologist that you are seeing now, but you see a person who is either in the same town or close by. You're in Southern California. There are tons of places like City of Hope and doctors around there that have awesome myeloma specialists that can coordinate the care between your local oncologist, hematologist, as well as with the myeloma specialist. But you know what? The way I look at it, I would love to have 5 extra years, you know, that I can see my grandchildren, you know, go to their activities, watch them graduate, all those things. And I'm sure you might feel the same.
Oh,
Were
yeah.
you going to say something?
No, I was just going to say outstanding information. Thank you for sharing. Definitely.
Yeah, and as far as specifics about what doctors look for, you know, as far as beginning treatment and such as that, it really can vary, you know, doctor or medical center to medical center. There are some gold standards that they do look at. My doctor looks at, you know, if your kappa, you know, is 10 or above, they want you to do some kind of treatment. I don't know, you know, what your local, you know, specialist would recommend, but that's just mine. And I'm in the Kansas City area. I go to the University of Kansas,
My
and I've
cap
done,
is currently sitting at 21.
Yeah, yeah. Well, they probably would recommend them. My doctor would, but like I said, you need to. I would talk to a specialist. It's not that your oncologist, hematologist isn't good.
Right.
It's they see a lot of patients, and they aren't
Agreed.
always able to read up on the latest treatment for myeloma, which would include when to start treatment. You know, at what level. So for your sake, I would check that out.
Excellent.
But you know, clinical trials, I'm on my 4th clinical trial right now. So another thing, if your doctor does look at treatment, they'll probably mention to you a possibility of clinical trials. So, you know, they're starting to treat myeloma earlier than years ago. You know, years ago it was watch and wait. You know, but they've decided that when a person has healthier cells, T cells in your body, it might be to your advantage, you know, at that time to work on getting rid of some of those myeloma cells with healthier T cells.
Sure.
So that's a thought, you know, something to consider. Um, I think you know you're doing, you know, you're seeing someone, you're doing the right thing. But those suggestions that I just made are things that jump out at me. Is there anything else that you had a question about?
No, outstanding. Thank you again, like I said, for sharing that. I did want to mention though, on the idea of hope, there is a gentleman in my pancreatic support group that does not have a pancreas, and he has not had one for about 6 years, and he is not even on insulin, believe it or not.
Oh,
So yeah, it is possible. Yeah, so it's not the death sentence it used to be.
Yeah, when I was diagnosed in 2013, this is almost 11 years for me now.
Okay.
I was teaching, and at the time I was told 3 to 5 years. And so it makes it a little scary,
Mhm.
to say the least, but it increased very, very quickly. Those are based on, you know, clinical trials and patients from years before. So it takes a while for those numbers to be readjusted and brought more current. So from what I hear from most of the doctors now, it's 8 to 12, but that just means, there are people that go beyond that, and there are people that go under that, less than that. So it's an average, and like I said, it'll be 11 years this month, actually, 11
You,
years
are
this
you
month.
currently on any sort of treatment?
I am in a clinical trial. I had what they call a CAR T, which is where they take T cells, and I've had 2. The first one I did in 2019, they took my own T cells and reprogrammed them and then reinfused them so they could attack myeloma cells. Well, what I did in November, which is the new CAR T that I just did, am participating in, they took someone else's cells, and they didn't, have to wait. It was considered off the shelf. So I got someone else's T cells, because after you've fought this for a while, your T cells get tired. And my doctor said he thought, that could be the case, with T cells that have gone through lots of treatment, which I have, very, very, a lot, of 5
When you
or
say a
6.
lot of treatment, are you saying you've gone through chemo as well?
Oh, yeah. In
Okay.
between the clinical trials, yeah, I've been on Revlimid, Pomalyst, Velcade, Kyprolis, iberdomide, a variety of other things, that's in between that I didn't even necessarily know about, because they did it through infusions when I was in the hospital. So there are a lot of things. A lot of the treatments, the CAR Ts and things, used to only be available to people who had 5, maybe 4 or 5, other drugs or treatments that they have experienced. Now, the FDA approved earlier So that's one thing that a specialist, a myeloma specialist, would be up on and would be able to help you with.
Very good. Thank you again.
Lou, before we leave you, I do have a mark by your name that you're going to give us an update. So why don't you, and then after that, we'll go to Germany.
Yeah, I probably didn't, I might have included some of that. My labs that I did 2 weeks ago, they still consider me in remission. My numbers, it's myeloma. It's not curable at this point, but my numbers are increasing slightly, but I'm still in the remission area. So, this is what I look for. I look for last as long as it can, and then my big saying is, what's next? That's what I always
Well,
say to my doctor, what's next?
it reminds me of the comments made by Brian Kaufman, who is a medical doctor that has CLL and has had multiple treatments. He says, we're just kicking the can down the road. And we get that can so beat up, we kick it to the side and start kicking another can down the road. And fortunately, treatments have been changing and more becoming available that are better than what we've had. So that's a plus. Anything else, Lou? Okay, well, let's go to Germany, where it is after midnight. Barbell's over there patiently waiting to hear from us, and it's probably approaching 2 a.m. or 3 a.m. or something.
Going on 3 o'clock in the morning, yeah. Well, I had an appointment at the dermatologist at the end of April, but just getting there was a challenge. I guess that all the streets leading to the clinic were under construction. So we had to drive all kinds of detours until we got there. But the doctor said she doesn't think it's from COVID. So they took 2 biopsies and some swabs. They made photos, they took blood work, and they will look a little closer into it. I get the results at the end of May. But in the meantime, I have some cream, cortisone cream that I apply, and it's almost gone. I mean, I still have to take out the threads that they put in where they took the biopsies, but it's really healing. It looks a little bit bluish, green, and red at the moment. But the watery bumps which I had before, which I couldn't explain, are not there anymore. So I have to see what the result will be. My blood work was good last time, so I had no issues with the blood work. The only thing that was elevated was the LDH, which means that tissue is degenerating. It probably has to do with the skin, because there is no other issues that I face at the moment. So I have to wait on the results in end of May, but I'm very curious what they say.
Oh,
Len, you're
I'm
muted.
muted.
Oh, there you go.
I'm muted. Yeah, Barbell, try again. Tell us when you were diagnosed and how many treatments you've been on.
I've been in the CLL 13 study, and I was treated with iputinib, obinutuzumab, and venetoclax. And then I was off meds for 30 months, and then I had a relapse, probably due to EBV virus, and was retreated with obinutuzumab and venetoclax. And I stopped treatment in March 2022, and ever since I'm off medication. And well, nothing has occurred in the meantime. So we'll see. I don't think I'll get it. CLL is really not my problem. It's more or less the immune system that doesn't function like it should.
Okay, well, thank you, Barbell. Anybody have any questions for Barbell? Okay, check by Barbell's name and by Lou. Mary Lou. Oh, we lost Mary Lou? I guess so. Um, Bill. Bill, you're up next. If you'll unmute your microphone. I think Bill has fallen asleep.
There's the mic button. Yeah, I had a hard day yesterday. I've been sleeping a lot. I didn't know if I'd stay awake for this. Um, I was diagnosed in 2006 with SLL, had FCR chemo then, and then I was fine until 2013 when I was diagnosed with CLL. At the same time that I was receiving a couple of heart stents, and my hemoglobin was real low, and they took me in a helicopter and took me to the hospital. Um, I live in South Florida, so I'm 4 hours from my doctor, my specialist, CLL specialist. So I was on ibrutinib for a while, and that gave me real bad pain in my joints and geographically moving around. So then I went on venetoclax, but just for a short time because I came down with a terrible shingles, uh, which knocked out function in my arm, and had PT for about 2 months after I got the shingles. And so that burned out the venetoclax. And then I was on acalabrutinib, Calquence for a while, but it seemed to not be working that well. So I've been on JPERC, was it pertobrutinib? And I had a PET scan yesterday that showed from 90 days ago some of my lymphadenopathy decreased, but a lot more got worse. So I've got probably lymphomas. I've got a lot of hot lymph glands in my abdomen. I've had diarrhea for like 5 months. I've lost a lot of weight, about 30 pounds just this year. And so I saw my doctor yesterday, wonderful doctor, Dr. Barrientos, and she suggested that I start on Gaziva, and I still can't say the generic name. Who that? So
Obinutuzumab?
yeah, that's it. I'll learn how to say it once I get it. So I'm scheduled for Monday to begin the scheme. A little bit the first day and more the second day, and then once a week. And like I said, I'm 4 hour drive from the hospital uh, where I'll be treated. Uh, and probably I should have started on the infusion maybe 5, 6 months ago when she first mentioned it, but I asked her if we could just stay on oral stuff and not get me up to Miami, every week for a month. So yeah, yesterday was a bring down. Also, she said it might be transforming to Richter's. I'm not sure yet, but it looks like it might be. So, bad news, but I'll do the treatment and hopefully it'll work and shrink these lymph nodes. And I had some severe pain from them on several occasions. And last week I had family visiting for my birthday, and I could barely spend any time with them. I was in bed with a lot of pain and using a lot of painkillers, but fortunately that got better, and I haven't taken any painkillers for a few days. Um, so that's where I'm at. I've been on several treatments, and I'm starting an infusion now. Probably stay on the peribrutinib, the J-Perca, while I get the Gazyva.
Yeah, the pertobrutinib, for those that are not familiar with the CLL treatments, there's what are called BTK inhibitors, and there's about 3 or 4 different kinds. You named ibrutinib, and then acalabrutinib, and then pertobrutinib. Pertobrutinib is one of the most recent ones, and it's non-covalent. If you remember your chemistry from high school or college, where the other ones are covalent type configuration. But
Evidently, it's not working as well as we hoped.
Yeah, normally it's when they fail, when ibrutinib and acalabrutinib, those early ones no longer work, zanubrutinib. Pirtobrutinib is uh, a slightly different type of BTK inhibitor and might work where the other ones didn't. Now, what about if your doctor says that you might have transformation to Richter's, is your doctor going to do a biopsy of the lymph nodes that were hotter
She,
to see what's going on?
not at this point. She thought that it may be trending that way. It wasn't transformed yet, so she'll be keeping an eye on that. And of course,
Yeah.
that's bad news.
Yeah, normally if you transform to Richter's, they want to start you on treatment right away. It's not no longer a smoldering type event. It's fast growing. We have a lady that joins us from Fort Worth that was treated a couple of years ago for Richter's, and she's still with us and still plugging along. So there is hope there, and there are also some newer treatments. They may still be um, clinical trial type treatments, but there are some new treatments that are showing some promise in that area, which is really good news. But we wish you the best there, Bill.
Thank you, Lynn.
Okay, Nancy. Nancy, my neighbor to the north. The rain missed us. Did it get you?
Hey, you guys. Yeah, Lynn, we just got some pictures from friends of ours, and they're in our life group, and they're in Holly. And she just sent me pictures of an amazing tornado on the ground. So not too far from where we all live, or where Lynn and I live. And tonight I'm actually in Fort Worth, so we'll get the storms later in the evening. Um, I guess my news is, can you see that? Does that look like a 12?
It looks like a 12. Is this the 12th quarter?
So this
Twelve,
is
12th
number
round?
12. And if you could see in there, there's only 4 pills left. So tomorrow is my last dose of venetoclax. And I have scans in the morning, and then I see Dr. Wolf next week. But it's kind of a sweet. It's been a sweet couple of weeks preparing for this and just seeing the, I've definitely been on a countdown. And it's amazing, and so many of you go through so much more. And I feel like I've been um, very blessed. This is my first treatment. I was diagnosed in 2019, and my spleen started enlarging in the beginning of 2023, and I started treatment in March with the obinutuzumab. And other than just having trouble getting IVs started, it's not been extremely difficult. I've done well, and I'm expecting excellent results, and I'm just grateful. But I do love hearing y'all's experiences and because I just think it's so many things I've never thought about and never about. And Lou, I really appreciate like the link to the health tree. That was great. That's something a resource I hadn't heard of yet. So I'm really grateful, and I'm glad that Audrey was on tonight. She's so young, and so she's I think she's just in that beginning stage of shell shock, and I had a little bit of time to process things because I was on watch and wait for a bit. And I was actually, when Lynn called on me, I was actually trying to look on my phone for Bill, and just to say something. I've just recently read something about a brand new treatment. Only one person over in the UK, and Barbell probably knows what this is. In fact, Barbell may have sent me the link or put the link out. It's like got a number, an NX56 or something. It doesn't even have a name yet, but I think it's amazing how these treatments just keep coming, and they're like, this is something called a degrader. It's going to
It only
approach
takes
things
away the
differently.
excess photolytic kinase, while the old ones, they bind the entire enzyme, but the degraders only take the excess.
So anyway, I'm excited. I know, I probably have a limited time where, like Lou was saying, it's not curable yet, but I'm very much looking forward to living life, full tilt boogie, and I just, really praying into getting back some of my energy. That's I guess my main goal over the next year is to become more energetic and just build that strength back.
Nancy, have you considered a port for your injections?
Oh, I'm
Before?
done with. I'm done. For obinutuzumab first line of treatment, you have like, I think I had 8 times where I had to get an IV, and my husband and I talked about it, and I just decided to really try and get through it, because I think the situation is that once you have a port, they don't really take those out, when you're and I felt like that with CLL, I could, try to, if I were looking at a much longer term, or if I had to have infusions often, then definitely I think a port. But I was able to get through that. So
Yeah, let's let Lou make some comments about the port.
I have had my port for over 8 years, and I was taking, at the time that I got it, was on Kyprolis and had weekly infusions. And the nurses said, "Hey, have you considered a port? It's much, much easier access and able to get, it done quickly," which I didn't know at the time. They could also do my labs, which I was doing labs every 2 weeks. And so my labs were able to be done and continue to be done through my port. My veins, when you've been on cancer treatment or chemotherapy for a while, your veins have a tendency to shrivel or start to roll, or sometimes become such that they can't get, anything through. So that was, something that I was starting to experience, where they were poking me 3 different times, to get something started. And that's painful, and the port, I have to say, is a godsend for me. Other people may have different experiences, but for me, it's a godsend.
So
The
Lou,
thing about,
with the port, you can still go swimming,
oh yeah,
bathe,
oh yeah, oh yeah, there's no problem.
because it's right beneath the skin. It's not
Yeah,
exposed.
yeah. And once they access it and pull it out, it starts to heal back very, very quickly. And, the next, you take showers the next day. It's not like, it's going to be infection prone. There are a few people in the myeloma support group in my, local area here who I think 1 or 2 have had to have them taken out, only because they stopped working because they had had them for a long time. Like I said, mine's a Bard power port, and I've had it over 8 years, so it's working well. The other thing I wanted to mention to you, as well as the others, since you talked about Health Tree as far as the videos and being a useful resource for people, the good thing is in the past, they really focused on myeloma patients. That's what the videos and everything was mostly about. But in the last year, year and a half, they have brought on leukemia research, studies, doctors who treat leukemia, who are also in the videos. So that's for anybody that wants to learn more about not just myeloma, but leukemia as well, and treatments and things. So yeah, it's a great resource.
Yeah, I've made a note to check out Health Tree. I haven't been there yet, but uh, another one that comes to mind is Patient Power, which think used to be just mostly CLL, but it has expanded to cover other types of cancer as well. So um, that's good. Nancy, was there anything else you wanted to share? Where will you be joining us from in June?
My husband and I, we are driving across the country starting May the 12th, and we try and spend as much of our summer as possible up in Vermont. And so I don't know who might be in the Northeast, but we'll be at Lake Elmore, Vermont.
Sounds like a wonderful place during the summer when we'll be down here and it'll be 105 degrees. Well, thank you for joining us today, Nancy. And Al joined us, and he's he's muted his microphone. He's turned off his camera. He might be taking a bath. I don't know.
Al's been having
Um,
some technical issues, so he
oh,
might hear us, he
okay,
might not.
okay. Well, I will give y'all a brief update on what's going on with me. Um, like some of the rest of you, it seems like it's not just the cancer that's a problem for us. There tends to be other side issues that are problems for us too. And my side problem is what's called idiopathic pulmonary fibrosis, which means I've got problems with my lungs, and the doctors don't know why. Never was a smoker. Don't think I was in never a very bad chemical environment or anything, but they feel like, and I was talking to my pulmonologist last week, they feel like that the drug treatment that I was on for 9 years probably accelerated the lung issues. The lung issues were were really not, they were negligible. They noticed ground glass images in the bottom of my lungs on the CAT scans back in 2013 when I was diagnosed with SLL. By 2019, they said time out. You know, the radiologist reading something's going on here. You need to send this guy to see a pulmonologist. Well, at the same time, I was trying to get my doctor to take me off of the drug I was on, and he did not want to because it was working, and it's a drug that you take continuously. So anyway, in the midst of all that, I changed doctors. I'm now seeing a doctor UT Southwest in Dallas. My doctor at MD Anderson has retired, and my doctor at UT Southwest said, I really think that this drug you're on is compounding the situation. And so I saw a pulmonologist at UT Southwest, and she said, yes, your lungs have gone down even more since your last pulmonary test. And so, but the good news is, yesterday on Friday, we went in and did the usual pulmonary test, and it's something to smile about. There's no further deterioration. This has been two visits, one 6 months ago, and then this one last month. She wants me to come back again in 6 months, but looks like the deterioration has stopped. So the progression of the pulmonary fibrosis has stopped at this time. I said, is it because I'm on a drug holiday? I'm off of this cancer drug, or is it because of the drug you're giving me, which is called Esbriet? Pirfenidone is another name for it. She says, we don't know. We don't know if it's one or the other or both. But anyway, we celebrated and went to Papa Do's afterwards and had a nice lunch. And so we get these celebrations when we can. I try to keep from doing a cartwheel in the waiting rooms when we leave, because that might hurt somebody. But somebody else might try to do it too. Anyway, that was good news. And she said, come back in 6 months. So I'll see her again in October. I'll see my cancer doctor in September. And I think there's not a whole lot of appointments this summer. I think it's going to be a quiet summer, medically wise, I hope. So that's the end of my story. Okay, well, we've come to the end of all the,
Lynn, is Jim still on the line?
yeah, Jim is still there. Jim,
I had a question.
did
I had a
you,
question, Jim.
Yes, I am
yeah,
still on
Derek
the
got a
line.
question for you.
And Jim
Okay.
will have an answer.
I've opened the box.
Let's see if the
Jim,
camera starts up.
understood.
Sure.
No problem. Question. Yeah, when you were diagnosed with prostate cancer, what were your
Yeah.
PSA levels?
Oh, the PSA, believe it or not, it was actually 3.2.
Oh,
But
wow.
no, the thing I found out after I was actually blindsided with this is, and I did a sort of a research thing because I was uh, really upset about it, was there are things that you can do that you can artificially inflate the number, and there are
Correct.
things that you can do to then artificially deflate the number.
Oh,
And I've got about 9 pages of things that I found about equally the amount that can raise it and the amount that can lower it. Like, for instance, I was overweight, and the more overweight you are, the lower it goes. I was also taking aspirin. It drops it 3%. I was taking Lipitor. It drops it 13%. I was overweight, and according to a study, I dropped it 16%. And then the night before, I took a Tylenol, which dropped it 5%. So a 3.2 with 3, 13, 16, and 5 is not a 3.2.
right.
So it was,
So
and
what's
it was
so what
found
stage
actually
was it?
accidentally looking for something else.
And what stage was it when it was found?
Stage 4.
Oh, wow.
Stage 4, as she said at the time, they thought that I had essentially a gastrointestinal infection because I had 2 of the large lymph nodes in the back were all puffed up. And they said, you have a gastrointestinal infection. And they hunted and hunted and hunted and couldn't find anything. And I felt wonderful. And I must have had it for almost 3 years. And as I said, uh, the doctor, well, the first test I had was a 5, but it did a PSA free test that said there was a 28% chance, but the doctor did not believe it, and he never told me anything about it. Then it
Oh,
dropped to a 3.2, and he was like vindicated. So, yes. And I wrote all of this stuff up education wise. So I don't know if you're interested in how all this stuff works or not.
oh, yeah. So the reason I asked is because last year my PSAs were elevated, 4.5, I believe, which prompted a scan. The scan did show some nodules on the prostate. I
Right.
did have the biopsy done. They took, I believe, 9 slices off the prostate. They all came back benign, knock wood. That was last year. And the next step was to test the PSA again in 12 months, and I'm coming up on that mark
Well,
now.
actually, the recommendation now is to do it in 6 months, every 6 months. The world in that has changed, and I'll
Okay,
put my email address in the chat.
thank you.
If you're interested, I will be happy to ship you the papers I wrote.
Jim and Derek, I'll make the connection. I
Oh,
can
Thank
go
you.
okay.
ahead and do that. Yeah, I'll take care of
Okay,
it.
fine. Yeah.
Perfect. And then, have you
Okay.
had any treatment, Jim?
Oh, yes. And that's another story. And actually, the reason why I'm in here is, okay, I have a sister with MM, but also in the VA classed any cancer within lymph node to be non-Hodgkin's lymphoma, which is kind of strange, but anyway, but hey.
Bill's going to go. Bill, see you later. Glad you could join us, Bill.
Thank you, Lynn.
Okay,
Thank
Bill.
you all.
Be well, Bill.
Alexa, isn't there a prostate group
Oh,
part of AnCan?
absolutely.
It's
Okay.
basically like which prostate cancer group would you like? We have
Okay.
Well,
several. We
actually,
have multiple every week.
he would be more in either the active surveillance or the
Yeah,
low intermediate.
active
Probably
active
active
surveillance.
surveillance group would
Okay.
have more of an more pertinent
Applicable.
to how you are today. But as I said, I happen to write up all kinds of stuff to educate you, written by a patient in layman's terms, so you can be educated more than probably a primary care doctor is taught in school, because they are hardly taught, or even a urologist, because a urologist is a surgeon. So, as I said, it isn't a slight against them, but that's just the way it is.
Got it. Thank you for sharing.
Okay. Okay. Al has come back. Al, do you need to give us an update on anything?
No, I'm good. Thank you.
Well, glad you could join us today. And Nancy didn't tell you all a while ago, but her husband is also a doctor, but I think he leaves the specialty work to the specialist. But when she said she and her husband talked about getting a port or not, well, he would have had some knowledge about that, and so, and I think he might have. I think he
Well,
treated.
my husband also is a cancer survivor. He had his prostate removed almost 10 years ago. Yeah, he's given me the 10 years ago. And so he definitely was listening in on those last comments.
And Nancy's father-in-law was a immunologist, world-renowned immunologist at UT Southwest Dallas. Is that right?
Yes,
Wow.
he did a lot of research that has really impacted things that we're receiving as treatments. And he was an immunologist, and his area where he really uh, focused was lupus. And and actually, I don't know near as much. I'm an artist. Ask me about paint, and I can talk.
While she's been getting treatment, she's been painting, and some of her paintings will be in an upcoming book that's being released, children's book. So we're excited. Maybe she'll next month. Maybe she'll be able to show us the book, and we'll. But anyway, she's very talented. Well, it's been good to see everybody, and Michelle is sorry she couldn't be here. Did we have somebody else that needed to say something? Al's
I
waving
will.
goodbye.
Yeah. No, I
Oh,
just want to say hello to Derek and Nancy. I think we got some new people. And I just want to introduce myself. I'm Al Rubalcaba. I'm down in Tucson, Arizona, and I was diagnosed in 2020 with an MPN, polycythemia vera.
and how rare is that diagnosis, Al?
What it is, it's my bone marrow creates too many red and white platelets, and too many of them. The
Yeah.
blood becomes thick and pasty, like molasses.
Okay. Yeah. That's
So are
not
you on
good.
warfarin?
I'm sorry?
Are you
Are
on
you on a blood
warfarin?
thinner?
Blood thinner?
No, just a baby aspirin and
Oh,
hydroxyurea. Yep,
perfect.
just a baby aspirin a day and hydroxyurea. When I was first diagnosed, I think I must have went through maybe about 4 or 5 phlebotomies, and just staying hydrated and eating well and doing what I can.
Great news.
Okay. Well, I think we're going to sign off tonight. Been good to have everybody here. It's 20 after the hour. It's time for me to eat supper. It's time for Marvell to make breakfast. So we'll see y'all in a month.
Bye bye.
Yes.
Thank
Bye,
you.
everybody.